MB, a 28-year-old male from Quezon City, consulted a doctor because of blood-tinged sputum. History. 2 months prior to consult, the patient had non-productive cough associated with low-grade fever and occasional colds. He took antitussive to relieve the cough and paracetamol for fever, which afforded temporary relief. After a few weeks of on and off colds, the cough became productive of yellowish phlegm with blood-tinged sputum, malaise, and loss of appetite. Scientific classification of Mycobacterium tuberculosis is a kingdom, which is a bacteria, the phylum, which is the Actinobacteria, the order, which is the Actinomycetalis, the suborder, which is the Corynebacterianae, the family, which is the Mycobacteriaceae, the genus, which is a Mycobacterium, and lastly, the species, which is a Mycobacterium tuberculosis. Mycobacterium tuberculosis is a pathogenic bacterial species in the genus Mycobacterium and the causative agent of most cases of tuberculosis. It is first discovered in 1882 by Robert Koch. Mycobacterium tuberculosis has an unusual waxy coating on the cell surface. Acid-fast detection techniques are often used. The physiology of Mycobacterium tuberculosis is highly aerobic and requires high levels of oxygen and primarily a pathogen of mammalian respiratory system. The most frequently used diagnostic methods for TB are the tuberculin skin test, acid-fast staining, and the chest X-ray. The Mycobacterium tuberculosis genome was sequenced in 1998.
Life cycle. Initial infection begins with the multiplication of tubercle bacilli within the alveolar macrophages and spread the original lymph nodes of the hilum of the lung into the bloodstream. Nonspecific inflammatory response evoked on first exposure to bacilli becomes granulomatous in lesions will later on calcify. Reactivation tuberculosis results from the breakdown of dormant foci as characterized by an accelerated inflammatory reaction. As lesion erodes into the air passages like bronchi, it multiplies rapidly. This bacillar craft out into the sputum and to the air for the next susceptible host to inhale, thereby completing the TB life cycle. Tuberculosis is a curable disease, but if left untreated, can lead to disabling condition and even death.
Mode of transmission. Tuberculosis is transmitted mainly by inhalation of infectious droplets produced by persons with pulmonary or laryngeal tuberculosis during coughing, laughing, shouting, or sneezing. Invasion may occur through mucous membranes or damaged skin.
Epidemiology. Roughly a third of the world's population has been infected with Mycobacterium tuberculosis, and new infections occur at a rate of 1 per second. However, not all infections with Mycobacterium tuberculosis can cause TB disease, and many infections are asymptomatic. The Philippines ranks fourth in the world for the number of cases of tuberculosis and has the highest number of cases per head in Southeast Asia. Almost two-thirds of Filipinos have tuberculosis, and up to the additional 5 million people are infected yearly. There are a number of known factors that make people more susceptible to TB infection. Co-infection with HIV, smoking more than 20 cigarettes a day, diabetes mellitus, and Hodgkin lymphoma, end-stage renal disease, chronic lung disease, malnutrition, and alcoholism.
Based on MB's record, he smokes 1 pack of cigarettes per day for the past 10 years and is an occasional alcohol drinker. He lives in a depressed area and works in a nearby factory. Therefore, he is susceptible for tuberculosis infection.
Clinical symptoms: fatigue and weight loss, anorexia and nose swelling, low-grade fever and night sweats, blood in sputum, chest pain, and shortness of breath.
Prevention and management. Prevention of tuberculosis in a single person aims to kill walled-up germs. They might be doing no damage right now, but they could break out years from now and become active again over time. To prevent sickness, your doctor usually prescribes a daily dose of isoniazid, also called INH, an inexpensive tuberculosis medicine. Isoniazid, or INH, stops the spread of tuberculosis in large populations. Taking isoniazid for up to a year, periodic checkups would be necessary to make sure you are taking it as prescribed and that it is not causing undesirable side effects. In some cases, intolerance or allergic response usually happens. The tuberculosis vaccine, bacillicalmette-guerin or BCG, may prevent the spread of tuberculosis and tuberculous meningitis in children, but the vaccine does not necessarily protect against pulmonary tuberculosis.
Treatment. Tuberculosis treatment is usually given 6 to 9 months. It consists of 2 months of isoniazid and rifampin in parazinamide, and 4 months of isoniazid and rifampin in ethambutol or streptomycin. The drug treatment schema may be changed according to the laboratory results. Antibiotics are very helpful in preventing the activation of infection. However, this may not be taken during pregnancy or in people who are suffering from a liver disease or alcoholism. Moreover, several side effects have been reported to be life-threatening. Patients who have active bacteria are usually treated with a combination of medications. The primary antibiotic, isoniazid, is used in conjunction of rifampin, ethambutol, and pyrazinamide. Streptomycin, a drug given by injection, may be used as well, particularly when the disease is very extensive already. The most common transmission is human to human, although there have been incidences of animal to human transmission through unpasteurized cow's milk.
History and family history. MB was diagnosed with primary complex at age 2. He was treated with rifampin and isoniazid for 1 week. His mother was positive TB and took anti-TB medications for 1 month. Unfinished TB medications can lead to further complex lung infections.
Etiology and pathophysiology. Pulmonary tuberculosis is caused by Mycobacterium tuberculosis, which is a rod-shaped bacteria with a waxy capsule. The predominant medium through which tuberculosis is transmitted is the air. Tuberculosis is an aerosol via mucus droplets containing the bacteria that are released from an infected individual when they perform any type of forceful expiratory effort. These particles remain suspended in the air, and, once inhaled by a susceptible person, they can cause infection deep inside the lung. The course of the infection initially presents as a primary infection which causes inflammation in a small area within the lung and is usually self-limiting. It takes 4 to 12 weeks after being infected for the primary infection to arise. The body's reaction to the infection is a cell-mediated immune response. This response is usually adequate to control the infection. Upon reactivation of the bacteria, a secondary tuberculosis infection can develop. In a small number of cases, the infection may not become inactive after the primary infection and may progress to a more destructive chronic form of primary tuberculosis.
Secondary tuberculosis is not self-limiting and is more problematic in the terms of causing further complications. These complications may include extrapulmonary tuberculosis, tuberculosis pneumoniae, pleuritis. The end result without treatment is often massive destruction of the lungs due to tollification and cavitation of lung tissue.